Hi, my name is Ashley Hibbard, and I am doing this presentation over borderline personality disorder. So, in this presentation, I'm going to cover the history, the DSM-5 criteria, symptoms, causes, and treatments for borderline personality disorder. Borderline personality disorder is defined by the Oxford Dictionary Online as a personality disorder characterized by severe mood swings, impulsive behavior, and difficulty forming stable personal relationships. Some of the history of this disorder, it wasn't always recognized as borderline personality disorder. The word borderline first came up in diagnosis in 1938 by Adolf Stern. He was an American psychoanalyst, and he used this term to describe patients that had some symptoms of psychosis or neurosis, but didn't qualify to be diagnosed in those categories. Um, and the patients would often um, show symptoms or behaviors during high stress situations or um, things of that nature, and then would regress and continue on living and functioning normally um, after a period of time. And then in 1975, Otto Kernberg uh, labeled patients as borderline personality organization. And that was to describe patients that showed behaviors of instability and disturbed psychological self organization. Um, and again, didn't fit the criteria for other diagnoses. Borderline personality disorder was not recognized as a mental disorder until 1980 when it was added to the Diagnostic and Statistical Manual of Mental Disorders, third edition. And then in the Diagnostic and Statistical Manual of Mental Disorders, fifth edition, there is 9 criteria listed to be diagnosed with borderline personality disorder, and people must the patient must exhibit 5 of the 9 criteria. Those criteria are frantic efforts to avoid real or imagined abandonment, which means um, always thinking that their partner is going to leave them, or almost like a paranoid sense, thinking that everybody is against them. And then the second one is pattern of unstable or intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So they either will really, really, really love someone, or they just really, really don't. The third is identity disturbance, poor self-esteem, very unstable thinking when it comes to self. And the fourth one, impulsivity in at least 2 areas that are potentially self-damaging: gambling, sex, shopping, substance abuse, reckless driving, binge eating. And it notes there that it does not include suicide ideation or self-mutilating behavior. Uh, the fifth one is recurrent suicidal behavior, gestures or threats, or self-mutilating behavior like self-harm, cutting, and things of that nature. That sixth one, affective instability due to marked reactivity of mood. Again, swinging from really, really happy and out to get them to really, really depressed, or just like really manic behaviors, and they can last a few hours to a few days. The seventh criteria, chronic feelings of emptiness, just feeling hollow. Eighth, inappropriate, intense anger or difficulty controlling anger. So, um, little things will bother that person and they'll just blow up over it. Like you leave a cabinet door open and it's the end of the world. Um, Transient self-related paranoid ideation or severe dissociative symptoms. Um, Again, just thinking people are watching them, people are talking about them, and then being dissociative, just completely disconnecting from everything around them. So some of the symptoms, they tend to surface in adolescence and early adulthood, and children under 18 typically are not diagnosed with the disorder because um, some of the behaviors can line up with developmental patterns and for those age ranges. So they typically try to wait until adult early adulthood to diagnose people with borderline personality disorder. Some of the symptoms, chronic instability, like just not able to regulate their own moods, extreme mood swings, irrational fear of abandonment, substance use, extreme anger, sexually maladaptive behaviors, suicide ideation, attempted suicide, self harm, and self sabotage when getting close to reaching a goal, like just finishing tasks sometimes, or say college, for instance, the person will get to the last semester of college and then completely bomb out. Things like that. Um, so when there are adolescent diagnosis of borderline personality disorder, uh, patients are diagnosed with the disorder during adolescence. Patients that are diagnosed with the disorder during adolescence often have negative outcomes over the course of their lifetimes. Patients suffer from extreme anxiety, eating disorders, substance use disorders, and have shorter life expectancy. Um, it's a lifelong diagnosis. Like it it really doesn't go away. But patients that are more competent have lower levels of neuroticism, have higher IQs, fewer or no co-occurring disorders, and are able to work full-time jobs and careers are more likely to stay in remission, whereas people with lower IQs, less cognitive function, um, more co-occurring disorders, extreme anxiety or substance use disorder and stuff, they tend to need more treatment and care to function in life. And um, a lot of times, according to like research and studies, the life expectancy isn't very long for persons with borderline personality disorder because of high rates of suicide. And then some of them co-occurring disorders can be depression, anxiety, eating disorders, substance use disorders. Some of the others that are listed include sexual disorders, impulsive gambling, things like that. So there are no definite causes pointing to why people get um, borderline personality disorder, but there are a lot of factors that contribute to the development of the disorder. And one of those is the psychosocial factors. Um, 80% of patients with borderline personality disorder are reported to have endured high amounts of physical, sexual, emotional abuse, and neglect. So the environment that people are raised in or they live in for long periods of time um, can contribute to the development of borderline personality disorder. And then that coupled with the biology of the brain, um, certain neurotransmitters in the brain that release serotonin, uh, when they're not functioning properly, when they're malfunctioning, they don't release the correct amounts of serotonin, and it causes a lot of emotional and behavior issues. But again, there are no for sure reasons why people have borderline personality disorder. There are some studies that show genetics can play a factor into that, especially in certain households where trauma is prevalent generation to generation. Um, that can have a lot to do with the causes of borderline personality disorder. And then treatments for the disorder uh, can range from medications, different types of therapy, and it all depends on the severity of the disorder. Some of the medications used are antidepressants, mood stabilizers, and antipsychotics. Um, and the reason being, if there are co-occurring disorders with borderline personality disorder, those medications are often used to treat the symptoms of the other disorders, which can sometimes alleviate the stress involved in borderline personality disorder. But currently there are no psychotropic medications that specifically treat borderline personality disorder, and a lot of the treatment for borderline personality disorder is intense therapy, but there is no one style of therapy that works for the disorder. So it's multiple methods of therapy blended together and then modified to treat the disorder. And in most situations, it's case by case. Uh, Again, depending on the severity, the person's IQ, and their cognitive function, they use psychoanalytic therapy, cognitive behavioral therapy, dialectical behavior therapy, and cognitive analytic therapy. And the therapists take a little bit from each one and blend them together to do what works for the patient. Um, some borderline personality patients may not have extreme behaviors necessarily, so the cognitive behavior therapy might not be as effective as maybe psychoanalytic therapy if they had high amounts of trauma in their childhood, and then just the cognitive analytic therapy and dialectical behavior therapy, they just a little bit from each one, and that is most of the treatment for borderline personality disorder because there are no meds for it. So treatment for borderline personality disorder is pretty expensive, especially the more severe uh, cases of the disorder. um, Cost varies depending on severity, and treatment can last several years. Most patients with borderline personality disorder don't really ever fully recover and show symptoms throughout their entire lifetime, and may require um, therapy for prolonged periods of time, several years. The average cost for treating borderline personality disorder is 12,700 ish to 19,200 ish a year. Mild cases of the disorder, patients will lead normal lives once treatment begins and may not even require prolonged therapy or things of that nature. Again, mild cases, they're going to have a higher IQ, a higher cognitive function, be able to work full-time jobs, have families, raise kids without any issues after they start treatments. In severe cases, patients can require more intensive treatments, and that could be inpatient hospital stays and inpatient therapy. Patients requiring higher levels of treatment may not be able to function well enough to work or socialize. So this is a huge financial burden for the families and loved ones, because sometimes if it's severe enough, that that patient with borderline personality disorder may require somebody to be with them almost all the time. Whereas a mild case, they just function on their own, and as long as their medications and therapy is regulated, they're fine. But severe cases, especially with co-occurring disorders, as far as like extreme severe anxiety, if they have crippling anxiety and then also show symptoms of paranoia and are constantly fearing life, and then there's just everything coupled in with it can make it more expensive and more of it's an emotional and a financial burden for their family and loved ones. So overall, borderline personality disorder, it is a very complex disorder in the fact that if there are co-occurring disorders, sometimes the symptoms can overlap each other, and the borderline personality disorder might actually be misdiagnosed as severe depression or anxiety, or maybe behavioral disorders instead of personality disorders. So it's hard to diagnose, first of all, and like once it's diagnosed, it can be managed, but again, it doesn't ever fully go away. And but with the right interventions and the right treatments, patients can live fully functional lives after so much time. And that's it. Thank you.